Today, I will demystify a common medical condition known as hernia and provide you with a simplified understanding of what it is, its causes, symptoms, and treatment options. Let's get started. A hernia occurs when an internal organ or tissue pushes through a weakened area of muscle or connective tissue. It can happen in various parts of the body, but the most common types are inguinal, umbilical, and hiatal hernias. The protrusion creates a visible lump or bulge that can be uncomfortable or painful. There are several factors that can contribute to the development of a hernia. Some of them include heavy lifting, straining during bowel movements or urination, pregnancy, chronic coughing, obesity, and even weak abdominal muscles. These factors put extra pressure on the affected area, increasing the risk of herniation. Now, let's take a closer look at some common types of hernia. Let's start with inguinal hernia. So this type is more common in men and occurs when a portion of the intestine protrudes through the inguinal canal in the groin area. Umbilical hernia, which is common in newborns, involves a small part of the intestine pushing through the abdominal wall near the belly button, while hiatal hernia occurs when the upper part of the stomach bulges through the diaphragm into the chest cavity, leading to acid reflux and even heartburn. Hernias often present some common symptoms, including visible lump or bulge in the affected area, pain or discomfort, especially when lifting or coughing, a feeling of pressure or weakness in the affected area, nausea or vomiting in the case of hiatal hernia, reflux and heartburn also in the case of hiatal hernia. Now, if you suspect you have a hernia or experience any of the symptoms mentioned, it's essential to see a doctor for a proper diagnosis. The doctor will perform physical examination and may order imaging tests like ultrasound or even MRI to confirm the hernia's presence and determine its size and location. Now, while hernias may not always cause serious problems, they can lead to complications if left untreated. These complications include incarceration, which is when a hernia becomes trapped and cannot be pushed back into the abdominal cavity, leading to severe pain and possible bowel obstruction. It can also cause strangulation, which is a more severe complication where blood supply to the herniated tissue gets cut off, causing tissue damage and even tissue death, also known as gangrene. Now, the good news is that hernias are actually treatable. The most common approach is surgery. The surgical procedure mostly involves pushing the protruding tissue back into place and reinforcing the weakened muscle or tissue to prevent recurrence. The surgery can either be a laparoscopic surgery, which is a minimally invasive surgery, where small incisions are made and tiny cameras guide the surgeon during the operation, or an open surgery, where a larger incision is made directly over the hernia site for repair. Now, while not all hernias can be prevented, you can reduce your risk by avoiding heavy lifting or using proper lifting techniques, maintaining a healthy weight and engaging in regular exercise to strengthen your abdominal muscles, treating chronic cough or constipation promptly, and also quitting smoking, as it can contribute to chronic coughing. In conclusion, hernias are common and they can be treated effectively with surgery. If you suspect you have a hernia or experience any symptoms, don't hesitate to seek medical attention. Remember this: early diagnosis and intervention can help prevent complications and ensure a better outcome. Thanks for watching the video. Be sure to support the channel by subscribing and checking out the playlists you can see on your screen right now. Until next time, bye for now.